Second, staring down a syllabus that covers literally every single system in the human body. You know that your entire career trajectory comes down to just one multiple choice test. So how in the world do you cram years of incredibly intricate medical knowledge into a few days? Well, today we're diving into the high-pressure world of medical licensing exams, and we're going to analyze the ultra-condensed marathon revision sessions that are designed to help aspiring doctors cross that finish line without losing their minds. Okay, let's take a quick look at our agenda for today. We'll be covering 1. The medical exam marathon. 2. What is rapid revision? 3. Mastering airway management. 4. General versus regional anesthesia. 5. High-yield anesthesia drugs. And finally, 6. The final exam push. Section 1. The medical exam marathon, the high-stakes world of medical licensing. To really grasp the sheer intensity of these marathon videos, we first need to talk about the grueling stakes that medical students face in their final months of prep. The medical licensing system is, quite frankly, an unforgiving gauntlet. Ask yourself, could you condense years of medical school into a single high-stakes testing day? The human brain can only hold so much information, right? Yet these students have to recall precise drug dosages, complex algorithmic interventions, and nuanced anatomy in literally a matter of seconds per question. We're talking about battling career-defining exams here, tests like NEET PG, INICET, and FMGE. These are massive, incredibly competitive tests in India that act as the ultimate gatekeepers to postgraduate medicine and licensing. For these students, success hinges on one very specific, highly practiced skill, turning a totally overwhelming syllabus into rapid-fire, accurate multiple-choice answers. At this point in the game, it's no longer just about understanding the human body. It is entirely about test optimization and pattern recognition. Section 2. What is rapid revision? Condensing the medical syllabus. So how do students survive this immense pressure? Well, the educational market engineered a pretty wild, high-octane solution. Enter LRR, or Last Resort Revision. This is a strategic method championed by various prep platforms to compress impossibly complex subjects, like anesthesia, for example, into manageable 3 to 8 hour intensive video streams. And let me tell you, instructors do not have time for slow, meandering lectures here. Every single minute is packed with what educators call high-yield information. If a topic hasn't shown up on a test in the last 5 years, it's gone, tossed out. It is basically an exercise in extreme academic efficiency. And an entire ecosystem has sprung up around this exact need. Platforms like PrepLadder, Cerebellum Academy, and Dr. G. Banu Prakash rely on expert faculty to deliver these super-structured crash courses. You've got instructors like Dr. Muhammad Wajid Ali focusing heavily on clinical scenarios and image-based questions, while Dr. John V. Bajaj prioritizes breaking down previous year questions. Then you have Dr. Arya Sharma, who takes the ultra-high-yield marathon approach, literally telling students exactly what they can safely skip to save time. It's highly tactical, deeply optimized learning. Section 3. Mastering airway management, the first pillar of anesthesia. All right, let's get into the actual medicine here. Arguably the most critical skill for any doctor is keeping a patient breathing, right? In these rapid revision streams, the exact steps of airway management are just drilled into students' heads. They take complex concepts and translate them into a rigid, memorable sequence. First, assess the airway. Second, grab the exact right tools, your laryngoscope blades and endotracheal tubes. Third, execute rapid sequence intubation flawlessly. And fourth, if that fails, instantly deploy the difficult airway algorithm. There's zero room for hesitation in the operating room, which means there's zero room for hesitation on the exam. Take Melon-Potty grading, for instance. This isn't just medical trivia, it's a predictive lifeline. By simply looking at the anatomy of a patient's open mouth, future doctors have to quickly categorize the airway to predict just how hard it will be to intubate them. Instructors hammer this grading scale over and over because knowing it avoids absolute catastrophe in the OR. And, perhaps just as importantly for the student, it perfectly answers a guaranteed multiple choice question. Section 4. General versus regional anesthesia. Systemic control versus targeted numbness. Okay, so the airway is secure. What's next? You have to pick the right anesthesia. Students must rapidly distinguish between the complete systemic shutdown of general anesthesia and the targeted nerve blocks of regional anesthesia. For general, the revision focuses heavily on MAC logic, minimum alveolar concentration, so they understand exactly how much inhalational gas is needed. Regional anesthesia, on the other hand, demands exact anatomical recall. You have to know the specific spinal levels to properly administer spinals and epidurals without permanently damaging the patient's central nervous system. But hey, knowing how to administer the drugs, that's really only half the battle here. These marathon sessions place a huge emphasis on recognizing dangerous complications. Instructors make absolutely sure that students can instantly recall the absolute contraindications to spinals. They need to recognize the terrifying signs of a high spinal complication, which is when the anesthesia travels way too far up the nervous system, or know exactly how to treat a post-dural puncture headache. The exam essentially wants to know, when things inevitably go wrong, can you fix it fast? Section 5. High-yield anesthetic drugs. Pharmacology for quick recall. Now we're getting into the chemistry of it all, where brutal rote memorization meets clinical application. A classic multiple choice trap that instructors love to drill is the distinction between amides and ester local anesthetics. Students have to categorize them instantly under pressure. Why? Because their metabolism is completely different. Amides, like lidocaine, are broken down in the liver, but esters, like procaine, are broken down by plasma pseudocholinesterase, which is an enzyme floating in the blood. Mixing these two up on an exam is a guaranteed loss mark, so the LRR courses make this distinction crystal clear. Picture this. You have less than a minute to recall the exact protocol for anesthetic toxicity. Could you do it? Because on exam day, these students absolutely have to. When local anesthetic systemic toxicity occurs, the patient's heart can literally stop. The immediate countermeasure taught in these sessions is lipid rescue. You are literally infusing a lipid emulsion into the patient to pull that toxic anesthetic away from the heart tissue. It is a rapid-fire, life-saving fact that they cannot afford to forget. Then there's the whole depolarizing versus non-depolarizing muscle relaxants concept, which is heavily featured on the test. Depolarizing agents actually trick the body by mimicking neurotransmitters, causing a brief muscle twitch before relaxation sets in. Non-depolarizing agents, however, take a different route. They competitively block those receptors entirely. Instructors ensure students perfectly memorize these mechanisms, along with their highly specific reversal agents, because they're going to be tested on it, no doubt about it. Section 6. The final exam push. Fast, smart, and focused revision. We're in the final stretch now. The last few hours of these marathon videos are just relentless. The pace picks up, the energy peaks, and instructors blast through a rapid-fire list of life-saving protocols. You'll see them rapidly diagramming exactly how to deploy dantrolene for a deadly case of malignant hypothermia. They rush through ASA grading for pre-anesthetic checkups. They break down complex ventilator modes, detail fluid resuscitation for shock, and speed through blood transfusion reactions. Every single one of these bullets represents a guaranteed exam question, distilled down into its absolute purest, most digestible form. And, after hours and hours of intense memorization, keeping the motivation up is absolutely critical. These sessions almost always end with high-energy rallying cries. You'll hear quotes like, revise fast, revise smart, UB key bar 150 par. That translates to hyping students up to push past that critical passing threshold of 150 marks. At this late stage in the game, the instructors aren't just teaching anymore. They are essentially coaches, hyping their students up for the biggest professional fight of their lives. Which kind of brings us to a fascinating question to close out this explainer. Looking at the sheer, overwhelming volume and lightning speed of this last resort revision, you really have to wonder, when years of complex medical science are compressed into just a few hours, entirely for the sake of beating an exam, are these students just mastering a test, or are they truly forging themselves into better doctors? It's honestly a remarkable testament to human memory and endurance, and a pretty incredible look into the modern machinery of medical education. Thank you so much for joining me today, and keep questioning how we learn.